In this session today, we're going to talk about health professional advocacy towards COP26. And we're going to weave a story about a range of different activities that have built up to a moment this morning. This morning, there was a session held as part of the UK government's presidency agenda called Climate Action for Health. And this is the first time, as I understand it, there's been a session specifically on health on the presidency's agenda at a COP. So it was a really major step forward in bringing the health arguments and the health issues into the heart of COP. I'm Alison Cox, and I am the Policy and Research Director at the Global Climate and Health Alliance. And the Global Climate and Health Alliance was set up in 2011, I believe. I believe, Richard, you were one of the founders. And we are an organisation that brings together health professional organisations, health students and health workers organisations all around the world who want to bring their voice and their advocacy on the climate crisis. So the next part of the story that I want to talk about is then the Healthy Climate Prescription Letter. Earlier on in the year, we'd been contacted by Lizzie Blenkinsop and Dave McConnell in the UK government, saying that they were putting together a health programme for the UK presidency, and they were really interested to hear from the health professionals and for us to to give us a platform to raise our advocacy voice. So that made us think, what can we do? So a small group of leading advocates within our movement came together and drafted what became the Healthy Climate Prescription Letter. Over a number of rounds of editing, we came up with this letter, and we really tried to focus on two parts to the letter. One was health professionals' experience of the climate impacts now, and the co-benefits of taking action on climate for health. And then we came up with some very strong calls, which are encapsulated in this board, which are about what we wanted to see from COP26, which is strong and urgent action to try and ensure that we keep the global temperature rises to within 1.5, that we have a just and fair transition away from fossil fuels, and that we find the funding necessary both for mitigation and adaptation and loss and damage, and investment in the low carbon and resilient health service. So that's the bare bones of the letter. I'm now going to bring in Dermot Campbell-Ledram, who is from the WHO, heads up the WHO's Health and Climate Unit. And he is going to talk to us about the WHO's own reports and his extraordinary effort to bring the messages to COP. So over to you, Dermot.
Well, thanks very much, Alison. It's a real pleasure to talk to you here and to make this connection with those frontline health voices, as Hal was just describing, who are now speaking up now so eloquently and powerfully on the need for climate action. And I'll just, if I could just have make a slight correction in something you said at the beginning, Alison. I think we have had health here before, and I think we have to pay tribute to some of the people who have been keeping this, who have raised health before and have been keeping this voice going. Because in fact, you may or may not be aware that health is actually right at the front of the UNFCCC. It's in the top line of the Rio Declaration which governs the UNFCCC. The right to health is actually right at the beginning of the Paris Agreement. And there are organizations which have been carrying on probably what was quite a lonely struggle to keep making the case that health is the most powerful argument for climate action. And I think, in the past, for example, when Fiji was president of the COP, they held a powerful presidency level event. And there are organizations like IFMSA. IFMSA have been champions on this for more than 10 years, passing the baton from one generation to the next. And we now see them go out into the world, and several of them are on your video, and they're doing wonderful jobs around the world. But what I think is absolutely different about this COP is that it is at a new level of seriousness now. So this is the first time we've had a health pavilion at COP. It's also the first time, as we'll hear in a minute, that we've actually had a substantive health program within the COP agenda. It's still not an agenda item. We think it should be an agenda item. We think it should have its own space. But you'll hear in a few minutes from the UK COP presidency about a very substantive program that is happening within the COP. But to get back to our own role in this, so about almost a month ago now, we launched our report on the health argument for climate action. And so we wrote it, if you like. We held the pen. but it was actually developed in consultation with the wider health community. So I think there are effectively 400 odd contributors to this report. And it's quite clear that it is the health argument for climate action. It isn't just complaining on health's behalf, arguing for a bit more space or some money for health. It's making clear that health is a really good reason why you should act on climate change. We need to protect people's health. And as we've heard, it's the voices of people who are affected by climate change, but also frontline healthcare workers who are protecting them, who are the most eloquent voices for acting on climate change to protect their lives. But also, perhaps more importantly and persuasively, that action to cut carbon emissions is really good for your health. And so we know that the health gains that would come from meeting the Paris Agreement goals would pay for the cost of mitigation. So we think we're bringing a really positive health argument to COP. So we launched that report at that time, but we launched it sort of in partnership, as you said, with the Healthy Climate Prescription Letter, because I mean, to be honest about it, we are UN bureaucrats. We sit in WHO. We can give out these prescriptions. But what is much more persuasive than that is that partnership with our team, which is every frontline healthcare worker in the world. That's who we represent. We represent them and the patients that they try and protect. So we were nothing but honoured to have that partnership with this initiative, which brought their voices forward. And then to make that commitment clear, we also had this opportunity when we heard about 3 months ago that there would be a team of cyclists from the NHS in England, launching from Great Ormond Street Hospital, which is a legendary hospital in the UK, Children's Hospital in the UK, who are going to take a message from children and on behalf of healthcare workers from London to Glasgow, stopping along the way at children's hospitals in association with the air pollution pods. And hopefully you'll hear a little bit about that in a minute. At which point we thought, they just asked us, could WHO maybe give a little bit of endorsement? And we immediately thought, we have to do better than that, because this is such a valid, strong effort that we have to lend it all the support that we can. So what we did is we got Dr. Tedros to sign our report, hand signed it with a message to Alok Sharma, the president. We haven't met him yet, we're still hoping. And I have to say, we hope we still get to meet him at the end of this conference, because if not, I think we're going to have to take it to the next conference. And Sharm el-Sheikh is about 4 times as far, but if we don't get to meet this president, then we'll have to just pass to someone who'll meet us. But that's hand signed by Dr. Tedros. He also signed the letter personally, and so then what I did was just to get on my bike and cycle that from Geneva to London in order to hand over to the healthcare workers to then take it on their ride. And I got to cycle with them for 1 day, which was the best day of the whole lot, because I got to talk to these amazing people who were treating children every day, and basically were not going to stand by and just treat children and then send them back out into a world which is being damaged by climate change. I could go on about this ride. It's very dangerous to ask a cyclist to talk about their ride, because I'll just talk for hours. I could go on about it's very painful. I put my body on the line. I was making a sacrifice, and it was quite painful. But really, it was just really enjoyable as well. So I feel a little bit guilty, getting any credit for this. But I do actually think that there is some kind of valid comparison there, or valid analogy. It was really enjoyable. It was quite tough, and so is climate action. But it is actually really positive. I came out, and I'm sure all of the other riders came out of this much more positive than before we started. And I think it is the same for mitigating climate change, that the things we need to do are quite tough. You do have to make an effort. There has to be an investment of resources. But it is actually better for you as well as better for the planet. And so, yeah, I and the rest of the team were absolutely delighted to make that connection between as I say, the sort of bureaucratic world we can sometimes inhabit, and to make that connection to frontline healthcare workers. Because I think, and just to make a final connection back to the way we opened this, I think we all have a role to play. So we were also really happy to see the editorial from the medical journals. We're happy to work with people doing adaptation projects in different countries and to champion them. and we all have a comparative advantage. But that voice of the healthcare workers is really, really critical, because they are the most trusted profession in the world, and they're in every community in the world, and they are actually stepping up now to also cut carbon emissions. So they're one of the few sectors, certainly with the NHS in England, which is not blah, blah, blah. They've set a target, and they're setting annual targets to reduce their greenhouse gas emissions, and they're meeting them. So I think we're just really keen to take everything that we've achieved within the last year or so to raise it to the next level, and then we just want to multiply it again.
Thank you so much, Dermot. And if you weren't following his travels on his Twitter feed, I really recommend you go back and look at his Twitter timeline. It's a lovely story, and you brought such personal messages about why you were taking on that journey, and explained really well why it's so important that health is non-negotiable, and why health should be at the heart of climate action. And you did it with some lovely dad jokes as well. So I don't want to encourage you to do any more, but anyway. But do take a look at that. And this brings us on to the next story. You mentioned that this extraordinary group, the Ride for Their Lives group of doctors, nurses, technicians, and workers from across a number of children's hospitals in the UK, but including the chief executive of Great Ormond Street Hospital. And I'm very much hoping we've got one of them on the line now, Terry Bayliss, who is a doctor and director at the Newcastle NHS Hospital Trust. She apparently rode every stage from London to Glasgow, and apparently was in the front group, the faster group, as we went. She's got some slides as well that we're going to share as she speaks, as we bring her up. And I'm very pleased to say we have with us the blue satchel that contains in it the WHO report signed by Dr. Tedros, the Healthy Climate Prescription Letter, again, that Dr. Tedros himself personally signed and encouraged all the WHO staff to sign, but has also, as we've said, been signed by 46 million organisations representing 46 million health reps. So I'm looking at our text desk. We have Terry on the line. Welcome, Terry. Thank you so much for joining us, and over to you.
Hi there. Thank you so much for inviting me to be here today. It's a real honour. My name is Terry Bayliss, and I'm here today representing the 70 healthcare providers who cycled 800 kilometres from London to COP26 in Glasgow in what was a really symbolic act of collective, collaborative and positive action to raise awareness of the urgent need to tackle air pollution and to deliver the Healthy Climate Prescription Letter. I'm also really proud to represent my own NHS trust, Newcastle Hospitals, who showed tremendous leadership by becoming the first NHS trust in the UK to declare a climate emergency. I'm showing a few slides as Ride for Their Lives was very much a collective effort. And I wanted to feel that we have here with us just the amazing riders and supporters that were part of the whole experience. Could I move the slide on, please? Thank you. So a little bit more about the ride and the riders. The ride was brought together by some extraordinary people who do need a very quick mention. The idea for the ride to raise awareness of the need to tackle air pollution came from Vincent Lee, the CAD manager at Great Ormond Street Hospitals. Vincent's colleagues Matt Shaw, the chief exec, and Mark Hayden, a paediatrician and active travel campaigner, then championed the idea to Tom Clark of the Climate Acceptance Studios. Tom worked with, I think, each of you, Richard, Alison and Dermot, to galvanise a global coalition of partners, including the Global Climate and Health Alliance, the Clean Air Fund and BUPA. And it's thanks to these efforts, the idea that Ride for Their Lives would deliver the Healthy Climate Prescription to COP26 was born, beginning with Dermot's quite remarkable feat of cycling from Geneva to London. I also want to make a really quick and special mention of Amy Sutton, the Children and Young People's Participation Officer at Great Ormond Street Hospital. On top of her day job, Amy was an essential part of the team and basically organised us all of us, before and during the entire ride, which I think was probably the biggest challenge in itself. Few of us here, you see on the screen, knew each other before Ride for Their Lives. And the first time we met in person was when we set off in London. Coming together from all over the UK, the group is a diverse range of representatives from 6 children's hospitals, from key health bodies, the brilliant young people from the Young People's Forum at Gosh, whose message we were delivering, and also from the public and private sectors, and even an award-winning artist. The riders included engineers, pharmacists, paediatricians, and sustainability experts, to name a few. And we shared a really focused collective common purpose, and that was to raise awareness that the climate emergency is a health emergency. It's affecting our children, and urgent action has to be taken to prevent the avoidable deaths and illnesses that are being caused by air pollution. We think that this large group of trusted, busy healthcare providers representing all parts of healthcare, the fact that they felt it was essential to take time from their personal and professional lives to take action and to use our professional positions to raise awareness, to push themselves to their physical limits and commitment to delivering our message. It gives me hope that together we can take urgent climate action that we need to. Could I have the next slide, please? The journey itself took 8 days. It was amazing to see it on the map. We travelled from London to Glasgow, stopping at 7 different points along the way, and during the journey we covered 800 kilometres, with the longest day covering just over 140 kilometres. We climbed a total of 26,867 feet, which equals 6 times the height of Ben Nevis. Some of us spent up to 13 hours a day in the saddle, and we all shared our message with too many people to count. In addition to our journey, participants from all over the world joined in to log their miles for the month of October, collectively reaching a total of 1 million kilometres travelled during the month. That collective action is also symbolic of just how far we can go if we work together. Could I have the next slide, please? Before, during and after the ride, we've all reflected on our motivations. When the ride was suggested, I wasn't sure we could pull it off. That so many of us committed signifies just how important tackling the climate emergency is to health providers. We recognised that the ride was an important platform to collectively raise awareness that the climate emergency is a health emergency that is disproportionately affecting children. As a group, we specifically highlighted air pollution, as we know that globally air pollution kills an estimated 7 million people a year. I don't think anyone here will be unaware that last December air pollution was named as a cause of death for the first time in the case of 9-year-old Ella Deborah, pictured on the left. Known as a funny, busy, clever, curious, sporty and musical young girl. Ella's mother joined us at the start of our ride in London, reminding us all of the importance of what we were doing and providing the extra motivation that we didn't even need, but was much useful for the long ahead. As healthcare providers, we know that the daily consequences of the impact of the climate emergency on health are growing more serious. In our hospitals in Newcastle, we are confronted with this every day. Chronic respiratory and cardiovascular conditions increase and premature deaths rise. In the northeast of England, we have 2 of the very best hospitals in the world, with some of the worst health outcomes. In our hospitals, we see the impact of this on children especially, with a combination of exposure to poor air quality and deprivation lead to chronic conditions in children and young people which they carry through their lives. We see firsthand that the climate emergency is a health emergency that's affecting children and widening existing inequality. That's my motivation. Could I have the next slide, please? Given the aims of our actions, the perfect backdrop and a further way of amplifying the message to our journey was Michael Pinsky's sobering artwork, The Pollution Pods, which recreate pollution levels in different cities around the world, and everyone who has a chance should visit and experience the pods for a starkly effective representation of the reality of our future if we don't take urgent action on air pollution. Next slide, please. Throughout the journey, we've aimed to engage others, and at many of our hospitals, our young patients were motivating us with their own work. One of our young long-term patients at Newcastle, Ishmael, wrote to our group of riders with a series of practical recommendations outlining the things that he thought our hospitals should be doing to tackle the climate emergency. And thankfully, we were able to assure him we were doing most of them. When the children, as well as the scientists, are telling us what the right thing to do is, I think it's pretty clear that we have to get on with it. We haven't got time, and our children's futures are already at stake. Next slide, please. So when I reflect on the journey, I feel very honoured to have been part of it. I learnt much from my fellow riders, and as a group we shared a tremendous sense of responsibility in delivering the Healthy Climate Prescription Letter for all who signed it. We also learned frustratingly that in our country, the necessary infrastructure to support active travel, a simple action that we can take to improving air quality and reducing emissions, is seriously lacking and must be addressed. When arriving in Glasgow, we shared a sense that while we've reached our destination, our journey is far from complete. As healthcare providers, we must continue to encourage advocacy and action and give people the time and space for this. As a group that have the trust of the public, by working together, we can make change happen. We all know that we have to continue making behavioural changes, and Right for Their Lives gave us a public platform to collaborate to raise important awareness of our message and of our actions and of our choices. Finally, I think, as well as being a personal physical challenge, the ride itself is symbolic of the challenge that we must undertake globally to address the climate emergency. The challenge is significant but achievable. It's urgent, but we can take significant steps by coming together. It requires us to commit as a collective. It can be done, and it will be hard, but it's possible. Along with COP26 and the world politicians, we all know we need to act and do all that we can to tackle this crisis. We are all responsible, and we don't have time to prevaricate. We hope that Right for Their Lives has amplified our message, and that the climate emergency is a health emergency for everyone, and particularly for children. And I know that we will definitely continue our journey of advocacy and action. Thank you.
Thank you so much, Terry, and for telling that story. It's, as you came out with some very powerful messages in there, that in a way, your journey, you were trying to express that it is a long journey, it is going to be difficult what we need to do, but it is doable, and it's really important that we all engage with it. That the health professionals are strong and convincing messengers, and that the climate crisis is a health crisis. So there was much more in there, but thank you very much for that presentation. And as I say, the blue satchel that you brought with you all the way is with us here, and we are still hoping to get our moment to present it to Alok Sharma at some point today. If not, like you say, we will take it to Sharm el Sheikh.